When you're in excruciating pain during labor, you're not focusing on the risks and side effects listed on that epidural consent form the doctor's handing you. Your future self in the middle of a contraction will thank you for watching this video because you'll be prepared and know all about epidurals already. After watching this video, you'll know exactly how epidurals work, you'll learn the pros and cons of getting one so you can make an actual informed decision about pain management during your birth. But first, who am I and why should you listen to me? Hi, I'm Liz, a registered nurse and kinesiologist. On this channel, I talk about all things pregnancy, postpartum, baby care, and much more. So hit that subscribe button for more videos and grab my free weekly newsletter where I send you tips and tricks on these topics straight to your inbox. It'll be linked down below. Quick disclaimer, this video is for educational purposes only and not a replacement for medical advice. Let's get started. Everybody says childbirth is the worst physical pain a human can experience, so understandably being freaked out about it only makes sense. Epidurals are the big guns of labor management. It's a special type of pain relief that uses medication to numb the abdominal and pelvic area during childbirth. Let's get into some of the pros of epidurals. Number one, it is hands down the most effective pain relief method that we have today for labor, giving you a much needed break from those intense contractions. There are other pain relief methods, but nothing takes pain away as much as an epidural does. Number two, an epidural can be really helpful, especially for long labors. Imagine being in a 10 out of 10 pain for 30 hours or more. This could almost make childbirth a traumatic experience, especially for a first-time mom. An epidural can help you rest, save your energy for the actual pushing phase. Sometimes moms get so worn out from the pain that they have no energy left for pushing, and that is when we really need your energy. So the medical team has to use tools such as forceps or vacuum delivery in order to help you get the baby out. Number three, some people also find that being free from pain helps them feel more present and focus on the incredible childbirth experience. Some moms are able to even grab their baby as they come out, and you just feel more in control of that experience. Number four, you still feel pressure. One thing to remember is that while an epidural takes away that sharp pain, you're still able to feel a sense of pressure. So you don't completely get numb all the way to where you don't actually feel anything. Now, why am I talking about this as a pro or not a con? You're probably like, I'm trying to get numb and not feel anything. What on earth? And that is because when your baby moves down and you actually feel pressure during that pushing stage, you'll actually be able to push the baby out. And we need you to be pushing that baby out because the baby doesn't actually just fall out on its own. So the fact that you could still push is good. Number five, having your birthing partner not see you in extreme pain. Now, I'm not saying that you should make your own birthing choices based on what your birthing partner thinks because ultimately the experience is yours. However, it does help your partner or your mom or even if you have children witnessing your birth not see you in extreme pain. Now, let's talk about the cons. Of course, like any medical procedure, there are always risks involved. Number one is that your blood pressure could drop. This occurs because anesthesia causes the walls of the blood vessels to relax. This is called vasodilation. When this happens, the vessels cannot effectively circulate the blood at a particular pressure, so you end up with something called hypotension, aka low blood pressure. This is an easy fix with medications, which we can give you in order to raise your blood pressure back up. This is why you actually get an IV placed in you when you get an epidural, in case we do need to push some medications in there, such as blood pressure medication. Number two is itchiness. So sometimes you might just feel very itchy from that epidural, and medication can be given for that as well. Number three is a headache. This happens because when the doctor is placing the epidural with the needle, more on this in a little bit, it might actually go a little bit too far and poke through a protective layer called the dura. This can cause a small leak in the spinal fluid. It's not dangerous, but it can lead to a pretty significant significant headache after you have the baby and go home. This happens because when you sit up, some of the fluid leaks out and changes pressure inside of your brain, which results in a really bad headache. Now, don't worry, there are ways that we can treat this, but it is something to just have an eye out for. Number 4, because epidural limits your ability to move your legs, you won't be able to get up and walk around. This becomes an issue because the act of moving around during labor is what helps push the baby further and further down the pelvis. Usually when the mom is in labor, she's uncomfortable and she's constantly repositioning herself, moving the baby further and further down. But this is where the role of the nurse comes in, or a doula if you have one. And one of our main jobs is to actually reposition you and keep you moving around. If your epidural is really well done, you should actually still have some movement in your legs so you can try certain birthing positions. However, this isn't always the case. Number 5 is that you can't get up and pee. You likely won't feel the urge to pee or urinate due to the numbing effects of the medication. And sometimes you may not even feel your legs much at all, which obviously makes it difficult to stand up. We'll need to use a small catheter, a plastic tube, to drain your bladder, because if your bladder gets too full, it could actually get in the way of allowing the baby to move down. And after delivery, it could actually get in the way of your uterus contracting back to its normal state. So with any medical procedure such as a catheter placed in your bladder, it could introduce the risk of infection, as well as the risk of not being able to pee for a while after delivery. But don't worry, we do make sure that you are not in an active infection when we do send you home from the hospital. Number 6 is that the medications in the epidural can actually cross the placenta, which might make your baby a little sleepy after birth. This can be problematic when initiating breastfeeding because the baby is sleepy and it just makes it a little bit more challenging. Number 7, a rare but serious complication can be nerve damage, which is a key reason why it's important for you to be as still as possible when the epidural is being placed. So it gets placed in your spine and you have to stay in a curved position, kind of like a shrimp, and you have to stay there and try your very best not to move even if you are having a contraction, because the more still that you are, the better the doctor can place that epidural. Nerve damage is extremely rare though. There are studies done on it and it's very rare. Number 8 is that your pushing phase may actually be longer. Without the full sensation of the contractions, the pushing phase of labor can just take a longer time. Knowing this helps you set realistic expectations for your delivery. Now, a quick note on the procedure and how it actually works. What is an epidural? What is it gonna look like? So a doctor will come in and place a very thin, flexible tube into a space in your back called the epidural space. I will put a picture of it somewhere up here. The medication then flows through this tube and provides continuous pain relief. Now, I know a lot of people might get completely icked out and you might be wondering if that in itself is painful. So here's the thing. The doctor uses a needle, yes, to numb before placing the epidural. And this is honestly the most painful part of the actual procedure. Compared to labor contractions, it's not as painful. The doctor will then also use a needle to make an insertion to guide the plastic tube into the spine. Think about it. You need to make a hole in order for that plastic rod to go in. But the epidural itself is not the needle. So after he makes that hole, the needle is no longer in the spine. It gets put away and only the epidural rod is left. And at this point, you're actually numb from the first injection, so you shouldn't really be feeling much of pain. There are no sharp objects in your back once the epidural has been placed. Another question that a lot of people might ask is, does it work right away? And the answer is not right away. It actually takes a couple minutes, usually about 20-ish minutes, to get the full epidural effect. So it's not like with a snap of a finger you have no more pain, but you do feel a reduced amount of pain gradually and gradually and gradually. Ultimately, the choice to get an epidural is completely up to you. My goal today is to just give you the information so that you can feel empowered and confident no matter what you decide. Going through the pain of childbirth can be very empowering. That's why a lot of people choose to experience it. However, if that pain turns into suffering, either mentally, physically, or emotionally, an epidural is there for you. It's an amazing advancement that we have for you, and you should not suffer and get traumatized by childbirth. At the end of the day, it is your experience and you should be able to pick what you want to do. If you're curious about what an unmedicated labor feels like, watch this video right here where I break it all down. I hope watching this video helped you understand what epidurals are. If it did, please give it a thumbs up and subscribe for more content, and don't forget to grab my free newsletter down below with extra tips. See you in the next one.